males, if you get young women using your medication at age 25, 30, pick a young age, they're going to be on your meds the rest of their life, probably, versus, medical conditions that might represent a bigger risk to a greater population, say the elderly. But, do we really want to spend our money producing a drug for people who are only going to be on it maybe 5 or 10 years? Mm-hmm. No, we're going after that young market. We want young people hooked on our drugs. Gee, go figure. Don't we have a drug problem in this country? I mean, how much more do we have to promote the use of drugs for some pseudo benefit? Maybe there is a benefit. I mean, I don't know. But how much money, how much time, how much energy, marketing, on and on and on, do we have to broadcast use of drugs to provide a benefit without really giving you the realistic risk, only to find out one day that risk was really, really serious? But it's all about what, Sean? It's about making money. Welcome back to Safety Matters. This is Russ Kendzior, joined by my co-host, Sean Joseph.
How's it going?
Wearing the merch today.
That's right. You know what? If you haven't gotten your merch, we'll get you the information to do so, but it's nice.
Perch the merch.
Absolutely.
Yeah, that's good. Very good. So, got to have a good show today. One that I think you're going to enjoy. It's one that I really wanted to do for a long time. And it really is kind of related to this, what I call propaganda that's put out by Big Pharma. And we're saturated with it. We just see it. We see it everywhere we go. I mean, I don't care what the radio station, television station, cable news station, online, you name it. We're just saturated with Big Pharma ads. And so with that, let's go ahead and start the show. You ready?
Let's do it.
Safety Matters in the News.
Safety Matters in the News. As I said, Sean, we have today's topic is Big Pharma's advertising campaigns and the risk-benefit of prescription drugs. There was a time where you couldn't advertise prescription drugs on television. Doctors were not allowed to advertise. Lawyers were not allowed to advertise back in I think prior to 1980 was the year that.
Wow.
Whoa, that changed.
We've come a long way.
Well, look at who's the biggest advertisers now, right? All the people that in the past could not, but they do. So we have this issue of Big Pharma advertising. You see these ads, right?
Yes.
One that I want to use as an example is an advertisement that is saturating pretty much cable TV around a disease known as psoriasis. You familiar with psoriasis?
I've heard of it, but I don't know what it is.
You don't know what psoriasis is. Okay, psoriasis is apparently a disease. It's like a rash that people get, and it's really more of an immune deficiency. So people have this immune deficiency and they break out. They'll have large patches of kind of red, looks like a rash, but scaly skin. And it's really unpleasant. A lot of people get it on their elbows or their face or their neck. And predominantly women that suffer from psoriasis will really want to do something about it because they don't look quite as attractive. So Big Pharma's pushing psoriasis ads, and I'm going to show you 3 of them.
All right.
And we're going to kind of do a dissection on it. We're going to go ahead and look at what Big Pharma's doing. How's that sound?
Let's do it.
Moderate to severe eczema still disrupts my skin. Despite treatment, it disrupts my skin with itch. It disrupts my skin with rash. But now, I can disrupt eczema with Rinvoq. Rinvoq is not a steroid, topical, or injection. It's 1 pill once a day. Many taking Rinvoq saw clear or almost clear skin, while some saw up to 100% clear skin. And they felt dramatic and fast itch relief, some as early as 2 days. That's Rinvoq Relief.
Rinvoq can lower your ability to fight infections, including TB, serious infections and blood clots, some fatal, cancers, including lymphoma and skin cancer, death, heart attack, stroke, and tears in the stomach or intestines occurred. People 50 and older with at least one heart disease risk factor have higher risks. Don't take if allergic to Rinvoq, as serious reactions can occur. Tell your doctor if you are or may become pregnant.
Disrupt the itch and rash of eczema. Talk to your doctor about Rinvoq.
Learn how AbbVie can help you save.
Okay, we just ran a free ad for Rinvoq. Have you seen this ad?
I have not.
Okay, if you watch cable TV, you will not be able to not see this ad. It just plays over and over and over. And of course, you watch the ad and it's pretty cool. People swimming and happy, the barber shop. But if you've noticed, half of the ad is a disclaimer. They keep you occupied, kind of like a magic trick. Look over here, and then the words pop up at the bottom of, oh, by the way, this stuff is really nasty. And so I wanted to kind of go through some of the information that they presented that you probably didn't catch.
I love that.
And good examples. Rinvoq. According to the ad, it can lower your ability to fight infections, including TB. Did you know that?
I did not, but that is not
Would you take a medication that would reduce your ability to fight infections?
Considering where we are in the world right now, absolutely not. So if it's the infection that it's as advertised, absolutely. But if it's going to prevent me from getting over other infections, no. Yeah,
so you watch this ad. It was clever. It was cool. It's addressing a problem of psoriasis that people suffer from, predominantly women. But the first side effect, first one on the list for Rinvoq is can lower your ability to fight infections, including TB. Number 2, serious infections and blood clots, some fatal.
Yeah. Cancers,
including lymphoma and skin cancers. Now, let's just kind of stop there. This is some serious side effects. Okay, this isn't dry mouth or itchy eyes. This is cancer, blood clots, serious stuff. So as you're trying to better manage your psoriasis, you are potentially bringing upon far, far, far more serious health-related problems. It goes on. Death, heart attacks, stroke, and tears in the stomach or intestines occur. Okay. You down with this?
Yeah, I mean,
I'm okay. Tears in my stomach, I'm okay with that. As long as I don't have a rash, it's okay with me that I'm not tearing up I'll tear up my stomach.
I'm not okay with it. I'll tell you what, as we're going through it one by one, immediate alarming signs go off in my mind that I would need to see a lot more information on exactly what are the risks here. So yeah, that's where I'm at right now.
We're not done. People 50 and older with at least one heart disease risk factor have higher risk of heart disease. So say you have a mild heart blockage or a heart murmur, any heart-related issue, you've just magnified the risk of additional heart issues. That's what they're cautioning you to in this kind of upbeat video. Don't take if you're allergic to Rinvoq, as serious reactions can occur. Hey, Sean, how in the hell would you know you're allergic to it unless you took it?
Yep. That's right. It's not intuitive to me either.
How are you going to know you're allergic to Rinvoq until you take Rinvoq? Okay. That seems like a catch-all. And of course, last, talk to your doctor if you are or may become pregnant. Obviously, that is not an issue for guys, but remember, this ad and the next two that I'm going to show you are aimed specifically at young women who are the most likely to be in that birthing age. So you watch the video and you think this is cool. I can get rid of my psoriasis, but they throw all these side effects at you. And it makes you wonder, doesn't it? Okay, a second drug that's being widely prescribed for psoriasis is a drug called Skyrizi. You ever heard of this?
I have not.
You have not. Well, we're going to go ahead and play the television ad that seems to bombard the airwaves 24/7. At least I see it a lot. So let's go ahead and check out the Skyrizi ad, if that's okay with you.
Let's do it.
Some days I cover up because of my moderate to severe plaque psoriasis. Now I feel free to bare my skin thanks to Skyrizi. I'm celebrating my clearer skin my way. With Skyrizi, 3 out of 4 people achieved 90% clearer skin at 4 months. In another study, most people had 90% clearer skin even at 5 years. And Skyrizi is just 4 doses a year after 2 starter doses.
Serious allergic reactions and an increased risk of infections or a lower ability to fight them may occur. Tell your doctor if you have an infection or symptoms, had a vaccine, or plan to.
Thanks to clearer skin with Skyrizi, this is my moment. There's nothing on my skin, and that means everything. Now's the time. Ask your doctor about Skyrizi, the #1 dermatologist prescribed biologic in psoriasis. Learn how AbbVie could help you save.
Okay, you probably didn't catch a lot of the words that were popping up on the screen about muscle aches and all these other side effects, which you didn't really hear in the voiceover. But Skyrizi, another drug aimed at targeted towards young women who suffer from psoriasis. It's a debilitating disease, mostly, as I understand it, unattractive visual. And so you can understand why women would want to take this drug. But again, the negative side effects of Skyrizi are quite worth looking at. They include things like serious allergic reactions, increased risk of infection, lower ability to fight them. Tell your doctor if you have an infection or symptoms, have a vaccine or plan to. Had a vaccine. Sean, that's a good one.
That's
Had a vaccine. Well, we've all been vaccinated, right? I mean, does the flu shot count, or the COVID vaccine, or you get the hepatitis or the shingles? I mean, we can go on and on and on. The question I want to know is, what the hell does it matter, Doc? I mean, why does the vaccine matter? And in what way does having been vaccinated with whatever vaccine, would this negatively impact my my ability to take Skyrizi?
It's a great question.
You know, nothing is everything. What the hell's her tagline? Everything is nothing.
I don't know. Yeah, I was thinking the same thing. I was like,
Nothing is everything.
It's like so ambiguous. It's like, okay, sure.
Yeah, I'm all excited about nothing.
Right.
Nothing except, my heart stops one day.
Yeah.
And so Skyrizi, interesting commercial. We're going to show you one more, Sean, if that's okay with you.
Let's do it.
I mean, for all the people who suffer from psoriasis, you can then see the next commercial, which is for Otezla.
If you have moderate to severe psoriasis, little things can become your big moment. That's why there's Otezla. Otezla is not a cream. It's a pill that treats plaque psoriasis differently. With Otezla, 75% clear skin is achievable. Don't use if you're allergic to Otezla. It may cause severe diarrhea, nausea, or vomiting. Otezla is associated with an increased risk of depression. Tell your doctor if you have a history of depression or suicidal thoughts, or if these feelings develop. Some people taking Otezla reported weight loss. Your doctor should monitor your weight and may stop treatment. Upper respiratory tract infection and headache may occur. Tell your doctor about your medicines and if you're pregnant or planning to be. Otezla, show more of you.
I found this ad. You see the parallels, very similar. Same
Absolutely.
theme, put words up, make it really cool. But one thing I thought was odd is, you notice in the last scene, they're like hugging a guy in a lobster outfit.
Yeah.
Well, that's one of the things that a lot of people will say about themselves that suffer from psoriasis is, I'm as red as a lobster. They get this red rash all over.
Wow.
Ooh, red as a lobster. Hey, let's hug the lobster. Ha ha ha, the lobster. But again, it's just an observation, Sean. Just trying to look out for the folks that are watching Safety Matters is what the hell is going on. And of course, you saw the ad, the same ad I did. Look at this stuff. I mean, if you're allergic, don't take it. Well, how am I going to know I'm allergic until I take it? Can cause diarrhea, nausea. By the way, they use the word severe. Severe diarrhea, nausea, or vomiting. So the first question I have of you, Sean, is what is the percentage? What is the likelihood of me getting severe diarrhea? 10% chance, 5% chance? They don't tell you that. It's just you might get it. Yeah. Associated risk of depression. Ooh, that's a biggie, isn't it? Young women have issues with depression, anxiety now, sleep habits. This stuff can really throw your depression into overdrive. They're not telling you by what amount, 10%, 20% risk, 80% risk. And so you have this associated risk of depression. Tell your doctor if you have a history of depression or suicidal thoughts, or if these feelings develop. So there's clearly a link between Otezla and depression. Some people have recorded a weight loss. Hoo-hoo, that's a plus, I guess, for some people. But get the last two here. Upper respiratory tract infections, headaches may occur. Tell your doctor if you are pregnant or plan to be.
They should start all of these ads with that from the very beginning.
And say it without a soundtrack and the guy dressed up in a lobster outfit. Say it that way.
It'd be nice to see absolutely a pharmaceutical ad without a soundtrack.
Right.
It's so hard to really hear what they're saying with this amazing party music always playing. 100%.
Had it, Sean. I've had it.
No, this whole segment is fantastic, Russ, because you mentioned the lobster, and I think what a keen observation. That would go over 99% of most people's heads. But you had to know the condition. You had to know a specific rebuttal and situation that they experience and the exact verbiage around it. And I think the reality is on the reverse side of the table, there's such strategic and tactical planning and dollars thrown at creating what we just saw to psychologically shift the perception of this is a fear to now this could be a positive at the end of pill taking.
Yeah,
and that's such a powerful stimuli.
Hey, Sean, nothing is everything. Okay. I mean,
yep. Clearly.
Let's go grab a lobster on the beach, with Mr. Lobster Man. All psychological. It's all, in my opinion, trickery. It's to draw predominantly young women who, have a legitimate concern about how they look. It's not a pleasant disease to have, but just tell me that. Oh, by the way, if you are pregnant, you're going to have birth defects with your child, or I don't know. I mean, what am I to make of this? But we're dissecting a 1-minute ad, of which all the ads that I'm showing you are 1 minute long, of which exactly at 30 seconds, actually it's 31 seconds into the ad, they start telling you all the side effects. So they bait you with the theme, the tagline, the song, the imagery, girls in a convertible. Think about the girls in a convertible. That's also subliminal. I mean, if you have a skin disease, you wouldn't want to be in a convertible, right? But now you can. Look, everybody, look at me. I'm in a convertible. Look at those girls that don't have psoriasis. Again, it's all clever.
Look at me.
You can see me now. Before I would not want, I'd be in a car with the windows rolled up because I have psoriasis and I want people to see my psoriasis on my face and my neck. But now I'm in a convertible. I mean, it's all planned out. It's not a coincidence, Sean. It's part of the scheme. And I just think it's so dishonest, especially the young people, young women who are really being tricked into buying this shit. And I don't even know if it works. I mean, maybe it does.
I think that would be a great thing too, right? A call to pharma companies where if you're really doing the job of finding true, meaningful, tested, proven solutions, a little less bland, straightforward presentation of the facts, a little less imagery and selling, because for the most part, right? I feel like we can all come to the conclusion that you shouldn't have to oversell and do too much for something that genuinely creates a good. So consider that, right?
I remember what they said. This is not a cream. This is a pill. Oh, well, cream. I guess people that suffer from psoriasis are used to putting some cream on. So this isn't a cream. This is a pill.
Here's a question with that, right? Like, okay, that's fine. Maybe the consumer at mass prefers a pill, but really and truly, is the management of psoriasis better with a cream or a pill? Because if it is a cream and you're ultimately deciding to do a pill for the consumer's convenience, the real focus should be on helping the consumer fix the issue safely.
Patient, Sean, it's not a consumer, it's a patient.
Right.
To them, it's a consumer.
Right.
To the medical community, it's a patient. Now, let's stop there because that's a good point. Putting a cream on, you can see the cream. Right? If you have a rash, you put cream on it, you see cream on the person. So this is not a cream. No cream. It's a pill. See, you won't see it on you. Okay, well, now that you took this pill, it's reacting chemically in your body, right? Where a cream may not. And so, again, it's just part of marketing 101, multi-million-dollar ad campaign put out by very, very sophisticated advertising professionals targeting young women who are vulnerable to buy into the need for this because of their consciousness about the way they look. And they think, look, Sean, you're younger than I am. You know what, young people, remember when you're a teenager, hell, you think you're going to live forever. I mean,
we're not.
You fall off of a building. I'm okay. I mean, you bounce. Young people think nothing bad will ever happen to them.
It's true.
So, yeah, I'm young. I'm healthy. I'll take this stuff.
That's
fine.
such a great point, Russ. Just the reality of who you're targeting and just bombarding it with so much stimuli where do you even really want to ask the questions? Because you're so young. Who cares?
You're young. You look great.
I didn't think about that, but absolutely.
It's all about your looks. I mean, we just want you looking hot, okay? Look, I mean, go to TikTok. It's just young girls doing stuff that young girls do for the most part, right? Like jumping on a trampoline or, whatever it is. They're just wanting to draw attention to themselves for their appearance. And I get it. I got it. Okay. I mean, I was once young, Sean, back in, I won't even tell you how long ago, but I was once young.
Still a kid,
but I'm just sitting here saying, as an older guy, dude, you're tricking people. And okay, there's hopefully a major improvement in the way they look, but at what cost? And just tell people what the cost is, because you don't want young women growing up and 10 years from now they're now infertile because they took Otezla or Skyrizi.
Absolutely.
But we told you there was this risk if you're pregnant or may be pregnant. I like that. May. Well, may when? Well, you may be pregnant one day, and if you're ever pregnant, and you took Skyrizi or Otezla, then you might have birth defects. But we told you 11 years ago that if you may be pregnant one day, never told you when, right? They don't say when you may be pregnant while taking this medication. It's you may be pregnant one day. So does this cause infertility? I don't know. I'm just speculating. All I'm saying is it has me ticked off, Sean. And, who's looking out for these people?
You have every right to be. I mean, there's a lot of forces at play, a lot of strategery, and unfortunately deception used in the selling of these drugs. So thank you, for drawing attention to this, because I think it's going to make future patients smarter. You don't have to take anything. Ask the questions and inform yourself.
Yeah, and we shouldn't judge people by the fact they have a rash. That's another point I would make. You got a rash. I call psoriasis a rash. That's what it looks like. I know it's more severe than it's immune deficiency, and it's not just a rash, but visually speaking, that's what it would appear to be, and it's not attractive. And I totally get it, but are you willing to, improve your, hey, let's go ahead and put, something on your head that would grow hair. Okay. And a lot of people that are bald will use some form of medication to grow hair. And you say, well, that's great. Now, the side effect is you might have kidney failure. You might have, your blurred vision. We can go on and on and on. But you have hair. Yeah. You got hair at the expense of blowing out your kidneys. Russ, now, I would like to know that, because me personally, I would deal with the hair issue. I don't want to have my kidneys fail because I really need them. Okay. The hair thing, I can live with it. Okay. It's an appearance factor, but you deal with kidney problems, you got a big problem. And so just be honest, tell the truth. Don't play games, especially with young people. Don't try to trick them. I'm not digging on that, that lobster. The minute I saw the lobster guy, that red flag. Because that's what they say. I look like a lobster.
Completely went over my head. So yeah,
lobster man. I wonder if lobster man had psoriasis.
And Russ, I want to thank you too, because this, what you just discussed, reminds me of a conversation I had with a female friend maybe 6 months ago. And so we were having a conversation just about, where things are in society. We're talking about a whole bunch of things, but at some point the conversation came to her perspective as a young woman. At that time, late 20s, now entering into her 30s. And her perspective, as a female, was that she's tired of media, magazines, social media constantly telling her and other women on what they need to look like to feel pretty. And on top of that, it changes so fast and often that it's creating real functional problems for people's mental health. Now, I'm thankful my friend just took a stand and she's like, I'm just not going to let them dictate XYZ. But the reality is not everyone has that position. And I think media, and then also the players within media should realize the impact that they have when they do things like this, right? When they play so much into the factor of beauty, looks, physicality, all those things. Sure, people may care about that, but that's only one part of life. So the more that we can also help as a role, right, creating that appreciation for who you are, regardless of whatever situation, however you want to improve or stay with your situation in management is your choice. But these companies, right, whether it's a pharma company, whether it's a beauty care company, they are not the de facto standard for how you need to look and feel about yourself.
And you know what? It's all about people trying to sell stuff.
Yes, that is the core.
Buy my this, whether it's makeup, clothing,
and they will use
buy my
that
because you will be cooler, hotter, sexier.
Exactly.
You'll have more boyfriends, whatever, girlfriends.
Exactly.
And it's just about making money. So if you understand that, they're just trying to hawk. They're hawking their crap. Makes life a lot easier to deal with it. But, again, young people don't have that perspective. I mean, this is coming from a 63-year-old geezer who's been down that road and raised a daughter and have a granddaughter now. So I kind of get it. I get the scheme. And you know what? Hey, have at it, man. I'm an American. I'm an opportunist capitalist. I'm all about making money, but just tell people the truth. Absolutely. Disclose the risk in a way that they take it seriously. Don't mask it. Sorry, Mr. Lobster Man. They should have used something different. I get it. Okay. And the lobster guy's cool. But, what can I tell you, Sean Joseph? How many Americans have psoriasis? How many people in the United States suffer from psoriasis? 8 million, 22 million, 47 million, 64 million.
64 million.
You think that much?
Wow. If it's not C, then I'm honestly scared. Wow. It's 22 or 8. Wow.
8 million. 8 million Americans suffer from psoriasis. About 2 to 3% of the world's population, which is about 125 million. So the reason I throw this interesting statistic at you is it's really not that many people, but it's a target market. It's a demographic of long-term sales. If you get young women using your medication at age 25, 30, pick a young age, they're going to be on your meds the rest of their life, probably, versus medical conditions that might represent a bigger risk to a greater population, say the elderly. But, do we really want to spend our money producing a drug for people who are only going to be on it maybe 5 or 10 years? No, we're going after that young market. We want young people hooked on our drugs. Gee, go figure. Don't we have a drug problem in this country? I mean, how much more do we have to promote the use of drugs for some pseudo benefit? Maybe there is a benefit. I mean, I don't know. But how much money, how much time, how much energy, marketing, on and on and on, do we have to broadcast use of drugs to provide a benefit without really giving you the realistic risk, only to find out one day that risk was really, really serious? But it's all about what, Sean? It's about making money, which raises the bigger question, okay? And that is, so what happens when people get hurt by these drugs? What are the consequences, Sean? What happens?
Let's talk about that. Before we do, let me ask you this. From prescription drugs, Russ, do you think that happens more often or less often?
I think people get sick from prescription drugs, then they go to their doctor, and the doctor will prescribe them a drug to address the symptoms that they're getting for the first drugs. So you see this a lot with elderly people. They're on 6, 7, 8, 10 drugs. Well, the one drug that I take for my blood pressure makes my blood thinner, so I need to have a drug to prevent my blood from thinning. Well, but when I take that drug, I get constipation. It's just endless, and it's just give me another drug. The logical extension. The question, what happens when people get hurt by these drugs? Want me to answer the question for you?
Sure.
Because it's also an ad campaign.
Yeah.
Okay. Here's what happens when people get hurt.
Attention, the FDA warns that the diabetes drug Actos has been linked to bladder cancer.
If you've taken Actos and now have bladder cancer, or if a loved one has died from bladder cancer after taking Actos, call the Goldwater Law Firm right now.
I'm attorney Bob Goldwater. If you took Actos and then developed bladder cancer, call us right now. You may be entitled to financial compensation.
If you have bladder cancer, the diabetes drug Actos may be to blame, and the manufacturer of Actos may owe you compensation for your medical bills and your pain and suffering. Call the Goldwater Law Firm right now for a free consultation.
There are time deadlines to file a claim, so call us right now.
If you've been diagnosed with bladder cancer, or if a loved one died from bladder cancer after taking Actos, call the Goldwater Law Firm. Call 1-800-555-1212. That's 1-800-555-1212. 1-800-555-1212.
Yeah, I'm kind of giving a free ad here, but when I first saw that ad, that black woman looked like the woman from the previous commercial with the dog. She wasn't, but that's the logical extension, right? You have one industry promoting drugs, downplay the side effects. You then have the legal industry that says after you've been harmed by this drug, meaning the side effects became very real for you, and you have a serious medical condition, call us, we're going to get you the compensation you deserve. Then it becomes a tug of war between doctors and lawyers, which again puts the patient right smack in the middle of a mess, which they didn't ask for, but they were, I'm going to use the word tricked. They were tricked into believing this would happen. We also see this with other types of medication. I mean, we have a lot of different drugs on the market, and these lawyers are gobbling it up. Let me show you another video, if you don't mind, Sean.
The cholesterol-lowering medication Lipitor has been linked to an increased risk of diabetes in women. The FDA added this warning to the packaging of Lipitor in 2012. Lonker & Associates is investigating cases of diabetes in women who are prescribed the drug Lipitor. The legal professionals at Lonker & Associates have decades of experience in pharmaceutical litigation. If you are a woman who took the drug Lipitor to lower cholesterol and develop diabetes, call us today at 800-285-4878 or visit us online at brianloncar.com.
So interesting fact about Lipitor, it's the best-selling drug in the history of pharma.
You know what? It's funny because it's a drug that is used to reduce cholesterol. And I had this conversation with my doctor. I said, he goes, you need to be on Lipitor or whatever, statin. I said, why? He goes, well, it reduces the risk of stroke and heart attack because of plaque buildup in your arteries, your heart arteries. I said, well, okay. Because my cholesterol is just a little high. And I said, well, what used to be high is now, or what used to be normal is now high. They always change the numbers. Well, if you have a cholesterol level of 300, 10 years ago, that was normal. Today it's 200. And then they say, well, it's going down again. So they're kind of like rigging the game. They're gaming the system where everybody's going to need to be on Lipitor or some form of a statin. So I asked my doctor the question. He's a nice guy. I said, so if you have high cholesterol, you might have a greater risk of stroke or heart disease because it clogs up your arteries. And he says, yes. And I said, well, what if I was to tell you I had a heart scan and it's in my file and I have zero blockage? I have zero blockage in my heart, not zero. Why do I need the statin? Well, because, high cholesterol has some really bad side effects. I said, yeah, the side effects, when I say side effects, I mean the side effects of taking the statin are A, it raises your A1C, so now you become diabetic, and B, most importantly, it poisons your liver. It's a poison. It's a toxin. So I'm going to take a drug that I know the negative side effects are poisoning my liver and raising my A1C for the benefit of reducing stroke risk because of buildup of plaque in my arteries, which I don't have. And then, of course, I got into this discussion. He said, well, at the end of the day, Russ, it's just genetic. I'm like, great. You're awesome.
Really?
You're awesome.
Oh, that's unfortunate. That's unfortunate.
Meaning some people just have high cholesterol. Just how they are. And I'm a guy, and I wouldn't say my cholesterol is high. It's just higher than what they would like it to be. And but the real risk is zero. But the risk of taking the drug is known. And so I'm sitting there going, I don't really think I want to do this. So last question before we wind this thing up.
Well, I just want to say good for you, Russ. And I think that's, as we're going through this, right, I'm very thankful, again, for the show and specifically this segment, because this is as important as it gets. We are a country of 300 to 350 million, and the reports are staggering with how many medications every age group takes, and it just goes higher with age range. So here's my position, right? This is not going to stop. Pharma continues to push out new drugs. They do it faster with more effectiveness. So the consumer and the people, we have to be more armed with the truth. I think this is where it starts. And what I really think this sheds light on is two things. The first is how advertising works and how they can present their level of the truth of information to help sell. And what you just mentioned, Russ, is your own personal anecdote of you had a situation that you want to investigate. You talked with your physician. Your physician also, to some degree, is going to have some level of perspective and a script. That does not make them necessarily the de facto answer. At the same time, I personally believe that it's wise, right, to listen to people who have really understand certain things that I'll put it this way. Having family members in medicine, I understand why there's a belief system that it's a lucrative profession, but I can assure you before any physician is entitled to whatever salary, they have to put in 15 years of making dead zero, if not getting into incredible amounts of debt.
Look,
but before we go into that, I'll just say that kudos to you, because ultimately this isn't about the physician. This is about you in this case, and you who forever's watching. If you're considering taking a drug, sure, do your due diligence extensively, because at the end of the day, pharma is going to be looking to sell. Sure, they don't want you to have something bad happen, but not more than they want to hit their margins. That's just the way the business works.
Yeah,
and same with physicians, right? They're incentivized to some degree to prescribe stuff. Obviously, they want to keep you alive. They don't want to get sued. That wouldn't make sense.
There you go.
But at the same time, right, there are so many unique aspects to healthcare management that it really does come down to a serious level of agency and ownership of the individual to know important things like heredity, right? Important things like the reality of your lifestyle and your choices. The importance of what situation am I dealing with and how important is this drug? All these factors need to be assessed. And if you're considering taking a drug, this is the big linkage that I see throughout everything that we're talking about is all that information is online available to you. But essentially no one will take the time to read through clinical trials, freely accessible with clear. I wouldn't say clear. I've tried to read some, it's long, it's boring, but the information is out there. If at the very least, ask the questions, because you did that and you were able to use your own judgment to make a great choice for yourself. Just ask the questions. It's important for people to ask questions and see the answers you get. And if something seems off, trust your gut. Go deeper into research. Don't take anything at face value. Pharma companies, physicians, anybody.
You hit it on the head. We're responsible for our healthcare. We're able to do it. You have to ask the right questions. But it begins with two things. One, I agree with what you said about doctors. Look, doctors have the cover your ass syndrome. If you come in and you test and you have high cholesterol and they didn't prescribe you a medication to reduce your cholesterol, they might suffer a malpractice lawsuit. I get it. I get it.
And they're covering.
They'll
never be able to practice again.
That's right. So I understand the risk, but I'm the patient. Tell me, hey, look, you have high cholesterol. There's an option for you to take a statin. It'll reduce your cholesterol, but it'll also raise your A1C, and that could be a bigger problem. But in other words, communicate the damn risks to me. And I don't get that. And I'm not the only one. I've talked to so many people who go to their doctor and get a bullshit story. And it just raises suspicion, which the question I have is the following. Does Big Pharma intentionally mislead patients as to the risks of their drugs? Is this an intentional effort? I think it is. I don't think this is a coincidence.
I think it's fair to say that, they absolutely use things to, I think mislead is a really strong, but to ultimately sell. And I think in selling, you're going to upplay the benefits and you're going to downplay the risks. So, call that misleading.
Well, isn't that the definition of misleading? The definition of misleading is I'm only going to tell you half the story. I'm going to I'm going to play up one side and I'm going to play down the negatives. And I agree. It's about selling products. But this is people's lives, Sean. These are real people's real lives.
Absolutely.
Their real health, their long-term health, not just short-term. This may impact their family and on and on and on. And it may affect their career.
Yep.
There's so much at stake.
Yes.
And I get it. They want to sell their pills. But communicate fairly and reasonably.
Absolutely.
Cut the frickin' hype.
Absolutely.
If you're gonna tell me about the upside of the drug, which I'm attracted to, I really want to have a thorough and fair understanding of the downside.
Absolutely.
And stop putting a damn dachshund in the ad because people love dogs. Right?
Yes. Our bodies are so complicated. They study the human brain. There's so many unknowns. So the reality is, quite literally, pharma does not have all the answers. Your physician does not have all the answers. They may have some, but because there's so many unknowns, we all owe it and deserve it to ourselves to ask more questions. And pharma and physicians absolutely have to play their part in telling the truth too.
And with that, we're going to bring this session to a close. Sean Joseph, very hearty, honest conversation about an important subject that affects, I should say, millions of people. And so anyhow, with that brings this episode of Safety Matters to a close. So I'm going to say au revoir, adios. Until next time, on behalf of Sean Joseph and myself, we thank you for watching the show, and catch us next week because we got another interesting, similar conversation that we're going to be having kind of related to this one. So stand by. So anyhow, that's all we got for you today, folks.
Ask those questions.
Ask those questions. Be a smart consumer. Take care of your own health because we're looking out for you.
Absolutely.